Have you actually ever considered how a urine pregnancy test works? And do you worry that they're accurate or not? Hi, I'm your local OBGYN. I love women, so let's talk about it. When you are using a urine pregnancy test, it is looking for a very specific hormone, and it's called HCG, human chorionic gonadotrophin. So this is a hormone that your placenta starts to make within a handful of days of fertilization. So once that egg and that sperm meet and that little cluster ball of cells implants into the uterine lining, this starts to leak out into your circulation. And it's not just in your blood, it's also in your urine. So what happens is some genius once upon a time made a test that has this little piece of paper indicator in it. And the paper indicator has these little receptors for HCG. So if you think about it, they're kind of like this little spoon reaching out trying to stick onto HCG. So if you pee out and you have HCG, that HCG is going to stick out onto our little HCG spoons on this piece of paper. And the more HCG that sticks onto those receptors in the piece of paper, that's what causes the paper to create a color change, which they make into the form of a line or a plus. What you need to know is it's pretty darn accurate, and it can usually be accurate within a handful of days of conception, about 98 to 99% within the first few days. And HCG doubles every 2 days, and it really only needs somewhere between 25 and 50 of the level of HCG for the urine test to turn positive. If it's a really old test, it could be bad, but otherwise it's pretty darn accurate.